He was the picture of health. Former Gator football player Doc Lucky had dedicated his whole life to keeping his body physically fit. Then, it hit him like a ton of bricks.
That Sunday, I put down 3 pallets of grass, and when I got through putting down 3 pallets of grass, I showered, and then I went straight to the weight room and worked out for 2 hours. And that Monday, I went in to get a physical, and the next day, about 3 o'clock in the morning, I received a call from a doctor, and when I picked the phone up, he said, "Are you Doc Lucky?" I said, "Yes, sir." He said, "You should have been dead a long time ago." Those exact words that came out of his mouth. I said, why would you say something like that? He said, your kidneys, they're not functioning like they're supposed to be functioning. And I told him I will go to the emergency room and I should get there by 8 o'clock. He said, no. He said, you can drop dead within the next 30 to 40 minutes. And guess what? I put my clothes on and I arrived at Shands within the next 30 to 40 minutes. And 4 months later, I received a wonderful gift. And I told my sister, now since I have part of your organ, I know all your business and all your secrets. So.
Kidney transplantation isn't a cure, but it is a very successful form of treatment for kidney failure that can improve your quality of life. As you're considering whether a transplant is right for you, there are some important things you'll want to know. Your commitment to be an active participant in your care is vital. First, it can be costly. Of course, there's surgery and the hospital stay and recovery. But one thing most people don't consider are the medications, which are also expensive. You will likely take them for the rest of your life. And there's some lifestyle changes too. It will require constant health maintenance. You'll need to make a commitment to exercise, watch what you eat, keep a daily routine, make and keep all your doctor and clinic appointments, and pay attention to your body by monitoring and reporting side effects and signs of rejection. Yes, it's a lot, but it's well worth the effort. It will give you freedom from dialysis, which means you can go places and do things you haven't been able to do. And you'll feel better. You will have more energy and you'll live a fuller and longer life.
After the transplant, all of the levels became normal. And I now have an energy level which far supersedes what I had prior to my transplant. And I thought I was pretty healthy before my transplant. I thought I was very active and very energetic. There's just no comparison between how much energy and how good I feel now compared to how it was before.
The transplant team will help determine if a transplant is your best option. The process starts with an orientation session where you and your family members will learn about the transplant process, get answers to your questions, and meet other patients going through the same thing. Following orientation, you'll meet with various transplant team members. A social worker will go over your social history, determine possible challenges you might have to overcome, and discuss these with you. The transplant team is also interested in making sure you have a supportive caregiver who can help you throughout the process. You will spend time with your transplant coordinator. Your coordinator will help you with paperwork and guide you every step of the way. She is your bridge with the medical team and your main contact person throughout the entire process.
You know who your angels are. They're your post-kidney transplant and your pre-kidney transplant coordinator. Those are your angels. Those are who watch out after you. And call them. That's what they're there for. They will help you. They know what's going on, and they're really there to help you. And they do a very good job.
You will also meet with a financial representative. She will review your insurance, help you determine how much additional financial support you might need, and whether you're able to cover the cost of the surgery, medications, and any future healthcare needs. Because the financial responsibilities are significant, not everyone who is medically eligible for transplantation actually goes through the process. You'll meet with a transplant surgeon and transplant nephrologist who will answer your questions about the procedure.
Have the questions ready for the doctor. They encourage that. They want you to ask questions and become your own advocate. I mean, you have to take care of you.
The unit here makes it very easy for people to communicate with them. They make it very easy to ask questions. They provide all the information anyone would ever want about a transplant.
A physician assistant will spend time getting your extensive health history and conduct a physical to determine your level of health for surgery. This includes reviewing any tests that you complete. These tests will likely include blood work, an EKG, chest X-ray, a TB test, and possibly others.
And I thought all you have to do is be added to the list. The doctor says you need a transplant, so you go on the list. It's certainly not that easy. I was told the tests I would have to take, I would have to visit the cardiologist, I would have to visit the gastroenterologist, I had to have a colonoscopy, I had to have an echocardiogram, I had to have this and I had to have that, and I didn't realize what it takes to have a transplant.
After the evaluation is complete, the transplant team will decide if you are a good candidate. The main things they consider are your personal risk, the safety of the transplant for you, your success rate, the likelihood you will follow through with your own care, and your ability to cover the cost of care, which includes ongoing health needs and medication for the rest of your life. Once the team determines you're a good candidate for a transplant, a donor is needed. There are two types of donors, live and deceased. Live donors can be a relative or non-relative who meets the health requirements and is a good match for you.
I did not let anybody know, my brothers or sisters. I let no one know about my condition. But once they did find out about my condition, sorry, they all called and they all volunteered to give me a kidney, and I thought that was I thought it was a wonderful gift, you know.
Live donor organs have a higher success rate. They work better, faster, and longer. With a live donor, there's no need to go on the donor list, and the transplant can occur quickly. A deceased donor kidney comes from someone who has died and donated their organs. The wait time on the deceased donor list varies, and it may take several years to find a kidney for you. Wait times are affected by many things unique to your situation, and they'll be discussed with you. Unless you're fortunate enough to have a close friend or relative who is willing to donate, you will need to go on the donor list.
As I put myself on the donor list, it was more like a great motivation to me to say, okay, I'm on the list, I have a chance to live, I can take care of my child, I can, and maintain my home and continue to work and do things. And so that was a big motivation drive for me.
UNOS, the United Network for Organ Sharing, is the organization licensed by the government to fairly allocate organs and tissue. They also oversee the facilities that do organ transplants. Organs are given based on a number of factors. A lot has to do with the availability of organs in your geographic area, and the amount of time you've been on the list is also considered. Another factor is whether the organ is a good match for you. That's why some people wait longer than others. Determining a good match is based on the type of kidney that becomes available in your area. Compatibility to your blood type and tissue type is important, along with your level of antibodies and health status at the time the organ is available. If everything matches up, you're on your way.
Well, they called me on Sunday afternoon. In fact, I didn't have an updated cell phone number on the call list. And we had gone just for a few minutes to the grocery store, and we came back, and my son said, "Mom, Shands called. I think you have kidney." And so I started to cry. I got on the phone and called the lady, and my transplant coordinator, and she said yes.
While you're waiting for a kidney, keeping your contact information current is extremely important. If they can't get in touch with you, you could miss your opportunity. And you'll need to be prepared to get to the hospital quickly, especially if you live far away.
They tell you to always keep your cell phone with you if you have a cell phone. Well, I kept mine with me every day, every night. It was beside me anywhere I went. One Wednesday night we went to church and I left it in the car while we were in church. When I got back out of church, I had a missed call on there. It was the transplant people. They'd called about a transplant, about a kidney, and by the time I called them back, it was too late. They had done called somebody else.
And I was fortunate enough to have gotten that phone call while on the tennis court, telling me I had the kidney available. So immediately everyone said, okay, let's get Mark in his car, let's make sure his bag is packed, and I always kept a bag packed in my car, and let's send him off with a cheer.
And then they called me and said, you need to come get your husband and y'all need to go to Shands. He's got a kidney. And I just was like, are you for real? And she said yes. And so I went and picked him up, and I was just like, I couldn't get there fast enough, but we were able to get in there, and I was so excited and just kept, praying that everything was going to go right. And it did. Everything went perfect.
When you arrive, you'll have a final health screening, and a cross-match blood test is done to determine compatibility with the donor kidney. In the cross-match test, they mix blood cells from you and the donor organ and observe them to see if they work well together. If they do mix well, the cross-match is negative, and the transplant can go forward. If your blood cells kill the donor cells, the cross-match is positive, which means your body would reject the kidney, and it isn't a good match. If your test comes back positive, you're sent home, but your status on the waiting list does not change. Surgery usually takes 2 to 3 hours. One thing patients are always surprised to find out is that your kidneys are left in place, unless there is a health reason to remove them. The new kidney is placed here, in the lower abdomen. Then the vein, artery, and ureter of the donated kidney will be connected to you. That's it.
It'd been so long since I had felt good that, it was an amazing difference. When they was wheeling me out of the operating room into recovery, I was like, man, I feel so good. It was just a miracle.
Once you come out of surgery, your vitals will be monitored, along with your fluid intake, urine output, and blood work to determine kidney function. You will immediately begin taking immunosuppressant drugs in order to reduce the risk of rejection. Medication will be provided if needed to keep you comfortable. You will be encouraged to get up and move the day after surgery. You'll also be allowed to eat and drink normally as your body recovers and your kidney function is restored. The average hospital stay is 5 to 7 days, but could be longer. During this time, your post-transplant coordinator will help you learn about your new medication, side effects, signs of rejection, and your new daily routine. After your transplant, your life will revolve around keeping your new kidney. That means taking all the steps necessary to prevent rejection.
I had a friend to give me a second chance on life. I was not going to fail. That was one thing I said. I was not going to fail. I was not going to let him waste something that was important to me. So my medication is number one to me. That's a priority thing for me. That's first.
Taking your meds on time all the time is the most important thing you can do. You will need to stick to a reasonable diet and exercise routine, and it's important to pay attention to your body and monitor your health. Your follow-up appointments, which will be often at first, are essential too.
The most important things I can think of right off: keep your doctor's appointments, take your medicine when you're supposed to, follow what the doctors tell you to do.
There's a lot to think about when you're considering a kidney transplant. Here are the most important points we want you to remember. Kidney transplantation requires a lifelong commitment. You must understand the commitment to obtain the medications and take them every day as prescribed for the life of the organ. The commitment to participate in your care by making the decision to go to all of your follow-up visits with the Shands transplant team. The commitment to have labs drawn as ordered by the transplant team. And caring for your new organ by understanding this organ is a precious gift. Understanding this organ was donated by the family of a loved one who has just died, or was donated by a healthy individual, both doing so to improve your quality of life. And understanding this precious gift will not last without ongoing proper medical care and your commitment to caring for this organ.
But I realized just how important life is when I read that first letter from my donor family. Such a beautiful letter. And I realized how important it was for that family that I survive, let alone the 7-year-old boy who gave up his life.
But the nice thing is, I'm alive. You know, I see my daughter growing up, and I see my son growing up. I see my wife every day. I see my family. So, you know, it's fair swap as far as I'm concerned to take medicine. So,
And I'm going to take care of it. I'm going to take care of my body, and I right now I'm just speechless. I am so happy. And I sing because I'm so happy. I sing because I'm free. His eyes is on the sparrow, and I know he watches over me.